Welcome back to the deep dive. If you've joined us today, maybe you're familiar with that constant hum, that sort of low-level worry, that
Mm.
feeling in your chest that just, well, it won't settle down, no matter what's happening.
Yeah,
We really want to start right here. Feeling anxious it's okay. It's a part of being human, isn't it?
absolutely. And if you're listening, perhaps you're noticing that this worry, it isn't just about one big thing, like a presentation or some stressful event.
Right.
If you find yourself worrying, about lots of different things almost all the time, please know this is incredibly common. You're definitely not walking this path alone.
No, definitely not. So our mission today is to take a deep dive into what our sources call generalized anxiety disorder, or GAD.
GAD.
We're going to try and extract the most practical, um, powerful knowledge, the symptoms, maybe what's behind it, and crucially, the pathways to hope.
And importantly, we'll do this without getting lost in clinical jargon.
Exactly. Focusing on clarity so you can maybe understand what you're feeling a bit better and what steps might come next.
Okay, so let's unpack this. A good place to start, I think, is that basic question.
Yes, absolutely. We need to sort of draw a line between typical temporary anxiety, like, the butterflies before an exam or a job interview, and this constant worry.
But that distinction is key.
Normal stress is temporary, isn't it? It's tied to something specific. So what makes GAD fundamentally different?
Well, the difference is quite simple, but profound. It's about persistence and scope. GAD is a mental health condition where the person is worried about many different things.
Okay.
Health, money, family, the future, often most of the time. It's like feeling perpetually nervous almost every single day.
Wow, every day. And that worry starts to seep into everything, really, compromising your daily routine, making even simple tasks feel, well, quite overwhelming.
That pervasiveness, that's the key thing you're saying. It spreads everywhere.
Yeah. To make this feel a bit more real, less abstract, let's look at a case study our sources mention. It's the story of Neha, a 35-year-old teacher.
Ah, yes, Neha's experience. It gives such a relatable window into this condition, I think.
What really struck me about Neha was that her worry wasn't focused. It wasn't just about school deadlines or her students.
Mm-hmm.
Her worry was diffuse. It spread everywhere. She was constantly worried about money, her parents' health,
Mm-hmm.
and she'd even spend hours stressing over really minor everyday things like, did she remember to lock the apartment door?
Yeah.
Hours after she'd left.
That's such a classic pattern. It really is. It's like having, I don't know, a dozen urgent browser tabs open in your mind all the time.
Constantly running.
Exactly. And what's fascinating here is how quickly that mental worry translates into physical distress. Neha mentioned poor sleep quality. She just couldn't switch off.
Right.
Her heart raced often, even when she was just sitting resting. And she felt perpetually tired. That's her body basically stuck in fight or flight mode constantly.
Oh, that must be utterly exhausting, just having that internal alarm bell ringing nonstop.
It really is. Neha's story sums it up perfectly, I think. This endless, self-sustaining circle of worry. You feel you just can't switch it off.
Spinning and spinning.
It just spins, yeah, seemingly without a clear cause or an easy solution. And this brings up an important question, perhaps for you listening right now. Do you often find yourself worrying intensely about many different things at once? A bit like Neha.
And if the answer to that is maybe yes or sometimes, let's look at the bigger picture, because often people struggling with this kind of anxiety, they might assume it's just, well, how they are.
Yeah, a personality trait.
Right. But these are actual, often profound physical symptoms too. Let's maybe walk through the checklist a bit.
Yes, recognizing the physical signs is so crucial. Beyond that core feeling of constant pervasive stress, we often see difficulty sleeping.
Trouble falling asleep.
Yeah.
Or waking up.
Could be either or both.
Yeah.
Trouble falling asleep, waking up repeatedly through the night, yeah.
And then there's that internal feeling of unease, like feeling restless. You can't quite get comfortable.
Exactly. Or feeling easily irritable, maybe impatient with people around you. And those physical symptoms, they really signal that the body is under stress. We're talking about chronic muscle tension, often neck and shoulders.
Oh, yes. I think many people feel that.
Very common. Frequent headaches, too, or persistent stomach issues. Things like IDS, maybe, that don't respond easily to the usual treatments.
And what about the heart? You mentioned Neha's heart racing.
Yes, don't forget the cardiovascular symptoms, palpitations, that feeling of your heart fluttering or pounding, or even bouts of dizziness sometimes.
Okay.
And critically, anxiety and low mood, or even depression, they often travel together. Many people with GAD also experience panic attacks sometimes, or specific phobias, alongside the general worry.
So it's rarely just one thing in isolation.
Usually not, no. It can be quite layered, which again perhaps encourages some self-reflection for you. Have you noticed your body reacting when you're stressed?
Like your heart racing when you're just sitting quietly.
Exactly. Or maybe your stomach tightening up frequently. It's just so vital to recognize that these physical signs are just as real and just as important as the mental worry itself.
Okay. So if those symptoms are sounding familiar, the next logical step is understanding, well, how is this actually diagnosed?
Right.
We want to be clear, this isn't about self-diagnosing from a podcast,
No, absolutely not.
but it's helpful to understand the process. What are doctors or healthcare professionals actually looking for when they diagnose GAD?
Okay, so they're mainly looking for persistence and impact. The condition needs to meet a few sort of strict criteria. First, the person has to be worrying about many different things, not just one specific issue.
Like we said, diffuse worry.
Exactly. Second, that anxiety has to be significantly affecting daily life. So it's hindering your ability to work or maintain relationships or even just to relax properly.
Okay, the impact is key.
Yes. And here's the crucial timeline our sources emphasize. These symptoms, this feeling of worry, it must have lasted for at least 6 months.
6 months. That's quite a long time.
It is. The worry needs to be chronic and, importantly, feel hard to control. You feel like you can't just switch it off.
That long timeline, I suppose, helps differentiate it from temporary stress.
Precisely.
Yeah.
It separates GAD from, say, an adjustment disorder after a big life event or just a particularly stressful few weeks. And sometimes diagnosis can be a bit complicated by avoidance.
Avoidance. How so?
Well, people might start avoiding situations, social events, even certain tasks, just to prevent that feeling of anxiety.
Yeah.
And doing that can sometimes mask the severity of the underlying GAD itself.
That makes perfect sense.
Mhm.
Okay, so we've talked about what it feels like, the symptoms, how it's diagnosed. Let's move to the why. What do our sources say about potential causes or risk factors? Why does this happen to some people?
Well, it's often a combination of factors, really, not usually just one thing. We see genetic elements like if anxiety runs in your family.
Okay, so a family history might play a role.
It can, yes. Also, past trauma is known to be a strong predictor. Interestingly, sometimes long-term physical health problems can feed into GAD.
Right, chronic illness brings its own stress.
Exactly. And also the misuse of alcohol or drugs. Sometimes people start using these to try and cope with the initial anxiety, to self-medicate, but it often makes things worse in the long run.
And we should also note, shouldn't we, the consistent statistical finding that women seem to be more likely to develop GAD than men.
Yes, that is a consistent finding in the research, though the reasons are complex and likely involve biological, psychological, and social factors.
But regardless of the cause, whether it's nature or nurture or a mix, what's the crucial first step towards feeling better?
I think it really comes down to being open and honest about your feelings when you talk to a professional. That transparency, that's where the healing journey, the therapeutic relationship truly begins.
That's a really hopeful point, actually.
Right.
Because it shifts the focus from just identifying the problem.
To finding the solution, exactly.
And this is where we need to pivot strongly to hope. Because GAD is absolutely treatable. That's the really good news here.
Definitely.
There are clear, effective paths forward. Our sources mainly talk about talking therapies and sometimes medicines.
Yes, and the cornerstone of talking therapies for GAD is usually something called cognitive behavioral therapy, or CBT.
CBT. Okay, let's unpack that a bit.
Yeah.
Because I think people hear CBT and it sounds a bit technical. What does it actually involve? It's not just thinking positively, is it?
Oh, not at all. It's much more active than that. CBT basically teaches you to first identify the specific negative or catastrophic thought patterns that are fueling the anxiety. You know, those constant what-if spirals.
Right, the what if this terrible thing happens loop.
Exactly. And then CBT helps you actively challenge those thoughts. To question them, look at the evidence, and replace them with more realistic, balanced alternatives.
It gives you actual tools.
Yes. Practical tools you can use in the moment to manage the overwhelming nature of the worry. It helps reduce avoidance behaviors and gives you back a sense of control. That's why it's often so powerful for GAD.
Okay, that makes a lot of sense. And the other main approach mentioned is medicine.
That's right. Medicines can be very helpful, particularly certain types of antidepressants known as SSRIs.
SSRI.
And simply put, these are medicines that help to gently balance certain chemicals in the brain, the neurotransmitters, which can make the anxiety feel much more manageable, both for your mind and your body.
Right, so therapy first, or medicine first, or
No.
both together. What's the usual approach?
Well, our sources suggest a general medical preference often is to recommend talking therapy, like CBT first, often alongside suggesting lifestyle changes too, exercise, sleep hygiene, things like that.
Okay.
The aim is often to empower you with those coping tools from therapy before starting medicine, if possible. But sometimes both approaches are needed together right from the start.
Or maybe a referral.
Yes, exactly. Sometimes a referral to a specialist mental health team is necessary to create a more personalized, comprehensive plan.
I think this is such a vital point to normalize. Talking to a doctor about your feelings, your worries, your mental state, it's just as essential, isn't it, as seeing one for a fever or a broken arm?
Absolutely. Couldn't agree more. Your mind needs compassionate, modern care too. It's all part of your overall health.
That really sums it up well. So if you're listening, or perhaps someone you know is struggling with this kind of constant worry, remember the central theme here today. You are absolutely not alone.
Not at all. And please reach out early. Don't wait until the symptoms feel completely overwhelming or unmanageable. The sooner you seek support, the better the outcomes usually are.
We really hope this conversation, this deep dive, has given you some clarity and perhaps some hope. We'd encourage you to follow or subscribe to the deep dive, maybe on Spotify or YouTube, wherever you listen.
And if this resonated, perhaps share it with loved ones who might be struggling. Sometimes just knowing there's a name for what you're feeling and that help is available can make a huge difference.
Absolutely. And know that resources are available. If you are seeking compassionate care and modern treatments, places like MedRep Hospital Jahanabad offer dedicated support designed specifically to help you regain control and feel better.
And maybe a final thought to leave you with. Remember, your mind and your body are your strongest allies. How will you take care of them today?
Thank you for joining us on the deep dive. We'll see you next time.